Thank you, Heather. Hi, everybody. So this is a story of, I guess, a story of about 18 months of work that has been very much an effort of collaboration across the sector, and it started really with a small conversation of a few of us at a meeting in Auckland, and we were getting concerned about the lack of access to PrEP and the need that existed among the community and the concerns about safe pathways, and sort of decided to start working together to make stuff happen rather than wait for the policy to kick it off. So just as a bit of background, where we were, as we've heard a couple of times today, HIV is definitely on the rise among gay and bisexual men in New Zealand. It is very stubborn and resurgent as far as an epidemic goes, and just to give you a bit of a picture of the burden that men who have sex with men face is roughly 2.5% of the population. Of the 2016 diagnoses in New Zealand, gay and bisexual men or men who have sex with men accounted for 89% of locally acquired infections. So there's very disproportionately affected, but a huge opportunity to target and work with that group to make an impact. And just as a further bit of background, looking at risk behaviour, this is behavioural surveillance from 2002-2014 of condom use. The grass green and the teal represent always or almost always using a condom, so frequent condom use. And we started to see that decline a tiny bit in 2011 and 2014. We actually have no data for a repeat, which would have happened this year if it hadn't been defunded. So we're kind of flying blind at the moment, but with resurgent rising numbers of STIs among MSM, we certainly expect that it has dropped, but it's very hard to say. So this was the picture 18 months ago of where we were at. And of course, at the start of this year, the picture was that Gilead and Mylan products had been approved by MedSafe for use as prophylaxis, and Teva was still waiting on their approval. And we're also starting to see, as far back as 2 years ago, rising awareness and access to PrEP. These are screenshots from a couple of years ago on Scruff. PrEP advocacy groups in Australia started advertising in New Zealand around what is PrEP, how to get PrEP. You can order PrEP online, and this is, they do a great job, these guys. But we sort of suddenly, we were aware of the conversations that have been happening on hookup apps, and a growing number of people talking about PrEP, and the unavoidable global news media which you see through social media. If you're gay and you're connected on social media, you would have been seeing stories about the role that PrEP is playing overseas. So we kind of were in a position where we couldn't just avoid it, even though there was no policy to support it, and that we knew that gay men were asking for it and we were trying to get hold of it, and that we had to be doing something to improve safe access. So one of the first things we had to do was overcome a medical legal barrier to actually make it safe for the clinician to be able to prescribe for importation, and safe for the patient as well. So this is a consent form that the patient signs to say they're making an informed decision around using PrEP, understand the risks, and absolving their clinician of responsibility for the quality of an imported medicine from overseas. And since that, I think it was late last year or early this year that we finally got that form, we now got 20 providers across New Zealand who are providing a PrEP service. A lot of those in publicly funded clinics, which is great, and some GPs as well who have high MSM caseloads. Part of what we do is get information out about how people can access generic PrEP from overseas. We go as far as providing people with information about the popular sites that other MSM globally are using to access generic PrEP. Of course, we can never guarantee the safety and quality, and we wouldn't do so. But we do let people know that there have been no reports of fakes from people that have been ordering from these sites, and there are thousands of gay men around the world accessing them. We've partnered with one of these sites, Green Cross Pharmacy, to provide safe access safe and affordable access for those who have a community services card. So recognising that not everybody can afford to self-fund $50 a month. If you've got a community services card, you can go to endinghiv.org.nz, upload just a scanned copy of your card and a scanned copy of your script, and you'll get free three-month shipment of PrEP, and you can do that repeatedly. And I'm pleased to say that we have recently got approval to actually extend that to anyone who earns less than a minimum wage. Less than a living wage, so $20 an hour. So we just need to work out the mechanics of that. But it is a really great scheme, and I encourage, if you have any patients or community contacts, who need to be on PrEP and can't afford it, this is a great option. Another component of what we've been working on for the last 18 months has been community education. These are community forums. This is the one we did in Auckland. We recently had one in Christchurch as well. We've got one in Hamilton next week, in Wellington at the end of the year, hopefully. And we had about 90 people come along. We've got a panel on the forum of someone living with HIV, someone using PrEP, a clinician prescribing PrEP, and someone from NZAF. And we just have a really frank discussion about what is PrEP, how it works, and it's an opportunity and how to access it and the different pathways to access. And it's an opportunity for the audience to ask questions and just get some honest answers and promote some great discussion. So I encourage you to come along to one if you're in a city where one pops up. Online information is a big part of our community education, so basic info, what is PrEP, a little quiz on there, is PrEP right for me, and a locator map to find a prescriber near you. We work to develop a patient information booklet that prescribers can give to patients that has everything you need to know about PrEP. It's very comprehensive, and it really tries to articulate that it's not just a prescription for some pills. It really is part of a comprehensive sexual health program that includes regular monitoring. I have 15 minutes, is that correct?
Sorry, you're right. Yes.
Thank you. Excuse me. So that it's part of a comprehensive sexual health program that includes STI testing and monitoring. And another part of that, we're really pleased to see that the community has actually stepped up after these community forums and have developed their own Facebook groups. This isn't an initiative that's led by us or it's owned by the community, but it's called Prepping NZ. It's got over 100 people in it at the moment. And it's a forum they use to discuss their experiences on PrEP and accessing it. And it's sort of peer-based education, true peer-based education. Another concern we had, at the start of this was knowing that a lot of people would be going to their primary health provider asking for PrEP and them not necessarily being equipped. So one of the things we did was partnered with ASHM to develop an online learning module for GPs prescribing PrEP in New Zealand, which is locally relevant information, which is great. And this is in the process of being updated at the moment to reflect the new ASHM guidelines and also to have CME points attached to it. There are copies of the new ASHM guidelines out on our stall as well. And we've been doing booths at various GP conferences and health sector conferences to get the word out there. We're also working with ASHM at the moment to develop a sort of a one-pager protocol document that would be easy for GPs to follow. Massimo, who's here in the audience, and Torrance Merkel at GP in Auckland have very generously partnered with the Goodfellow unit to deliver a podcast and symposium, a PrEP session at the symposium next year. And we're going to try and work together on a medical journal article as well to get the word out there. Another huge component of what we've been doing this year is advocacy. And hopefully some of you would have seen some of that. It really started out at the Big Gay Out, which is one of the biggest LGBT events in New Zealand. It happens every February, part of the Auckland Pride Festival. About between 10 and 15,000 people usually come along. And we were very proud this year to have our first PrEP tent at the festival. So This was the NZ Prep information tent. And if you've ever seen news coverage of the Big Gay Out or been to it, you'll know that there are a certain group that loves to come along. Sometimes they get a mixed welcome, and that's politicians. So this is the current Prime Minister, and this is the Leader of the Opposition. Both came to the Big Gay Out this year. So it's not unusual for them to come along, and they always want to get up on the stage and talk to us about how wonderful they are. But this year we said, look, well, hey, we own this event. Actually, we're the ones who put this event on. And if you want to come to the event, we want you to tell us what you're doing and what your commitments are to end HIV in New Zealand. So we put that very clearly in the invite. And we were, well, interesting, I don't know if this is coincidental or not, but this was the first year that the National Party didn't speak on the stage, but although they did come along to the event. But Labour made a policy commitment, which got quite a lot of coverage, that they would fund PrEP if they were elected this year. And not only that they would fund PrEP, but they would fund the crucial behavioural research which has recently been defunded. And of course, as you just heard, we had that was followed by the consensus statement, which really sort of was galvanising the sector around the opportunity of combination prevention and the role that PrEP can play in that. So let's quick look at some of the numbers, and I guess what I'm seeing here is a really huge amount of change in a short space of time. These are numbers from the baseline survey, which is a survey that we do. And so in November last year, 0.7% of respondents, about 1,300 out of 1,300 people, 0.7 were using PrEP. That's now 3.7 at the one we just did. This is raw data, by the way. Knowledge of what PrEP is had grown from 50% to 67%, and monthly visits to the website from 276 to 795. Where are you getting your PrEP from? Nearly 40% from overseas. Nearly 20% from the NZ PrEP study in Auckland. Reasonable amount without a prescription. Some people interestingly getting it from the Australian PrEP studies, which is interesting. Is your doctor providing tests to support safe use of PrEP? Just over half said yes. Disappointing to see a fifth that their doctor doesn't know they're on PrEP. And that nearly 15% no, some not sure. I'm going to guess that's a no. I'd like to think you knew if you were getting some STI tests and HIV tests done. Yeah, but this is a concern, and this is one of the reasons that we really stepped into this space, is that we could see the risk of people accessing it through channels that aren't safe, and obviously there's still more work to be done. Community education is key in that as well, and I think getting PrEP properly funded and delivered through a workforce that's ready to deliver it will really help improve those numbers there. I'm probably out of time, but just a little update. Teva, I'm very motivated to enter the market, so there is potential that it will be on pharmacy shelves at some point. It's just there's logistics around all that, but I'll keep people updated when we hear more. NZA for putting in an application to Pharmac for funding this week or next, for PrEP to really play an effective role, it needs to be implemented at scale and supported by government policy. And we were encouraged by the announcement today that the Ministry is supporting combination prevention. So that's a great start, and I'm sure we'll be able to achieve a lot more with the policy support behind us.